We often hear about lasers being able to resurface and rejuvenate our skin, mainly our face, neck, even hands. But what about using it to bring new life to an area that us ladies may be hesitant to talk about? Dr. Rakesh Nanda and Nancy DeVell from Grandview Aesthetic Center are here to tell us all about the Diva. And I'm not even going to try to kind of explain it, Dr. Nanda. I want you to explain what the Diva is.
So the Diva is a vaginal resurfacing laser. So basically there's two big things that happen in every woman's life, or that happen in at least one of those things: menopause and childbirth. A lot of women will have kids, obviously, and that's one of the most magical things that's happened in a woman's life. However, a lot of them want to kind of go back to the way things were before those kids in terms of their body. I don't think anybody can argue with that. So what the Diva does is it can actually have some great improvement in incontinence, vaginal tightening, lubrication, anything that was uncomfortable down in that area prior.
And I love, Nancy, how you were putting it before we did the segment. You said it's the working part of the woman, right?
It is. It's the workhorse of the woman. And, you know, a lot of times we were led to this technology because we do bioidentical hormone therapy in our practice. So a lot of the symptoms are directly related to having this treatment done. I personally have had 2 treatments. We talk about incontinence. I had incontinence as a teenager. You know, it's the laughing, sneezing exposure. So there's a way that this technology can be customized. Numbing is applied. In less than 3 to 5 minutes, the procedure is done. You're out the door and back to your life. And we talked about this prior, how important that is. And thirdly, within 48 hours, that incontinence for me after that first treatment was gone.
And we've even talked about the fact that it can be preventive. So even women who maybe haven't, you know, felt that they need something, you're saying this can help them down the road.
Yeah, absolutely. We were just talking before that a woman's waiting right now to get this done as we're here, getting numbed up, and it's that quick, literally. She comes in, she gets numbed up. This particular woman has had no kids so far, but she's had incontinence issues. So a lot of women will have that, whether they've had children or not, and she noticed such a great improvement with one treatment already with her incontinence, and she was like, I can't believe it. There was no downtime. She couldn't jump on a trampoline with her children, you know, with other kids before. And that's the big thing, is that these women that can't jump on that trampoline with their kids, or that, you know, can't get up there with their nieces and nephews, now can do that. So.
And I'm sure lots of women watching this are thinking, laser in that area. I don't know about that, right? Like, that's kind of the initial, like, uh-oh. How do you calm their fears?
That's a great point.
How do you kind of say this isn't going to hurt you?
So basically, that's a great point. So basically, people have said it feels the same as an ultrasound, basically.
Okay.
So the discomfort threshold is like a 0 to 2 out of 10. Literally, a lot of women have come and told me that, and they've compared this. They said an ultrasound can hurt worse sometimes. So that's the thing, is that it is a laser, but it's doing what it needs to do to regenerate that tissue. So it's doing collagen rebuilding inside the vaginal mucosa, and it's making things thicker. It's increasing lubrication. So a lot of women that had to use creams and estrogen because of vaginal dryness no longer have to do that. So it's increasing lubrication, helping things get a little bit tighter. Of course, there's some other benefits with that. So sexual intercourse is more pleasurable, whereas before it may not have been. And incontinence, hugest thing.
And Nancy, as you mentioned, you've had 2, but you noticed a difference after 1. So this isn't something people need to get multiple treatments for many years, right?
Well, the studies show for sustainability that 3 seems to be the magic number. So in the studies in developing this technology I did feel that after the first, but I went and had the second, and I'm going to have the third, because with that third, it's going to be long lasting. And that's about really, when we look at a technology, what's the magic number to get you so it stays with you and sustains you?
The best result.
The best result.
All right, Dr. Nanda, you want people obviously to come in, talk with you guys, see if this is right for them, if this is something they could benefit from.
Absolutely. There's a lot of other technologies out there, and we're well aware of this. We like to stay ahead of the game, which is why we picked this, because we're exclusive to have this in the Columbus area. No one else has this. We were the first ones to have this in the state, in the entire state of Ohio. So no one in Columbus has this right now. That's what separates us, because this is way less treatments, a lot less expensive, less discomfort. So a lot of people that are thinking, hey, I'm going to compare this and this and this, well, I want them to look at the studies, look at the long-term results, and that's what I think every woman should do. You know, I want to encourage them to do their research, see how this can benefit. Come and talk to us. We'll compare everything they want to know, and we'll answer all their questions.
All right, sounds perfect. Again, Grandview Aesthetic Center, all the info up on screen, so thank you both.
Thank you.
Thank you so
Thanks for having us.